Hello, and welcome to the gastrointestinal lecture. My name is Nick Theodosakis, and I'll be taking you through the gastrointestinal system. Not literally, of course. There's quite a lot of material to discuss, so let's get started and jump right in with a review of anatomy and physiology before discussing the digestive diseases and their therapies. Here we have a list of all of the different structures located in the retroperitoneal space. The second, third, and fourth parts of the duodenum, the ascending and descending colon, and the rectum are retroperitoneal. Both kidneys and ureters are retroperitoneal, as are the adrenal glands. Most of the pancreas, except for the tail, is retroperitoneal, as are the aorta and the IVC. You can use the mnemonic SAD pucker to remember the various retroperitoneal structures as seen at the right side of the page. This is an image that should help you stay oriented to the abdominal anatomy. Some important ligaments pictured here include the falciform ligament, the hepatoduodenal ligament, which contains the portal triad, and the gastrosplenic and splenorenal ligaments. The falciform ligament connects the liver to the anterior abdominal wall. It's a derivative of the fetal umbilical vein and contains the ligamentum teres. The hepatoduodenal ligament, as mentioned before, contains the portal triad, which consists of the hepatic artery, the common bile duct, and the portal vein. All important structures to know. This ligament actually connects the greater and lesser sacs, which represent two subdivisions of the peritoneum, and it's right next to the gastrohepatic ligament. I personally find this a confusing part of the anatomy, so let's use a different perspective to show these ligaments and their connections. So here we have the stomach leading into the duodenum. Above it is the liver, and you can imagine the liver has been retracted so you can see the site of attachment of the ligaments. Again here, we have the falciform ligament. Notice as before, it's connecting to the anterior abdominal wall. This image shows another view of the hepatoduodenal ligament, which connects the liver to the duodenum. Notice how a lot of these names give a clue as to what structures are connected. Obviously, the hepatoduodenal ligament connects the liver, hepato, and the duodenum, duodenal. Then just to the right we have the gastrohepatic ligament, connecting the liver to the stomach. Here on the end we have the foramen of Winslow, which is the access point to the lesser sac. There are two other important ligaments that connect to the stomach. One is the gastrocolic ligament, which is responsible for connecting the greater curvature of the stomach to the transverse colon. This is part of the greater omentum, and the gastroepiploic arteries travel within the ligament. The last stomach ligament is the gastrosplenic ligament, and of course it connects the stomach to the spleen. The short gastric arteries travel within the ligament, and it separates the left greater and lesser sacs. The final ligament to mention is the splenorenal ligament, which connects the spleen to the posterior abdominal wall and carries the splenic artery and the splenic vein. We'll take a closer look at the vasculature in a few minutes. But obviously, it's pretty easy to remember that the splenic artery and vein are in the splenorenal ligament. Moving on to the vasculature, here you can see a rendering of the abdominal aorta and important branches. The celiac trunk, which we'll look at in detail in a moment, is the first abdominal branch and leaves around T12. Below that, anteriorly, are the superior mesenteric artery at the top of L1 and the inferior mesenteric artery around L3. Between the mesenteric arteries are the paired renal arteries around the lower edge of L1 and the gonadal arteries at L2. The bifurcation of the aorta occurs at L4. So, from T12 down to L4, we have the celiac trunk, superior mesenteric artery, renal arteries, testicular or ovarian arteries, inferior mesenteric artery, and, at last,